Hello everyone, my name is Tony and today we're going to be talking about virtual reality or VR and what it means for healthcare. This is going to be a discussion of the impact of VR in the modern pediatric landscape in healthcare and its applications. So let's get started. All right, let's get into it. Here are our objectives. We have 4 of them, and these objectives are kind of how we're going to be going through the flow of the lecture as well. So the first thing we're going to do is we're going to summarize the background and context of virtual reality in healthcare, and then we're going to understand how the functions of virtual reality applies to healthcare purposes. After that, we'll evaluate the safety and the efficacy of virtual reality and then discuss the impacts of virtual reality on healthcare to wrap it up. Let's talk about some background and context. Of course, when we discuss virtual reality, the first thing that comes to mind is entertainment, because we've used virtual reality for a lot of tech stuff such as video games and watching movies. But since as early as the turn of the century, virtual reality has been postulated for many applications in the healthcare industry due to its rapid advancement in technology. So the increased processing power of the computers and the improved displays of the monitors, coupled with the decreased costs associated, actually reduces the barrier to entry, which we'll talk about in just a little bit. And one of the earliest uses of VR in healthcare and other fields as well was its usefulness as a training tool. But now, from skill assessment tests to simulations, the technology allows us to apply this kind of tech for all kinds of other purposes. In the past couple of years, one of the recent focuses is pediatrics. It's been used with applications in pain and anxiety management, and it's been used as a tool for helping control the situation in a situation where you might frighten a pediatric patient, such as administering vaccines or drawing blood, which we all know kids do not like. The benefits of this is that there's easier administration and there's less refusal because they don't actually see it, and there's a positive enforcement from wanting to play and interact with the virtual reality system, and there's a decrease in negative associations because they don't actually see the shot coming, so they're more likely to return to the clinic. The mechanism of action of virtual reality is actually pretty different than what you would expect from a medication, because you don't expect any kind of direct chemical change. But how it works is it mitigates and minimizes the effects of pain by altering the experience through distractions. Pain requires attention, and there is an attentional capacity that humans have. So if you were able to distract someone, then they would feel less pain or less stimulation if they're not paying attention to it. And some of the components of this is the visual and the cognitive and psychological components. And the good thing about virtual reality is that virtual reality covers a lot of this. By using visuals such as adventure video games or calming nature scenes, you could actually minimize the amount of visual impact that a shot could give you, as well as the cognitive value of it. You can decrease the associations because, as I've said before, they don't actually link the shot being given with any kind of visual stimuli. The psychological component actually comes a little bit earlier because it lessens the anxiety and the anticipation of these shots. Obviously, for virtual reality, there's no such thing as pharmacokinetics. But this slide is akin to what a pharmacokinetic slide would be for medications, because we're going to talk about administration and onset and metabolism. Now, for the administration of virtual reality, you're going to want to use goggles and headphones, mostly in conjunction. You use the goggles in order to give them a visual perception change, and you use the headphones to give them an audio perception change. Now, this put together has a very powerful impact on how they perceive the world. The onset, as you can imagine, is almost immediate, and it terminates almost immediately after the removal of the virtual reality device. There's no metabolism of virtual reality because it's a device, so there's no renal or hepatic adjustment, which is pro when you consider that a lot of medications do have those components. For the efficacy of virtual reality, I've actually broken it down to early small-scale studies and large-scale studies. For the early small-scale studies, you can refer to Hoffman down at the bottom, and for the large scale, you can refer to the pilot study by Silverberg, actually. For the small-scale studies, there's an objective part of a study and there's a subjective part of the study. In the objective part of the study, it showed significant reduction of activity in brain regions associated with pain via a functional MRI scan, and if you look at the images, it actually looks like it reduces the activity by more than 50%. For the comparable subjective evaluations of pain, they actually looked at it compared to opioids and found it to be very similar in terms of decreasing the intensity of pain, decreasing the overall unpleasantness, and shortening the duration of thinking about pain. In the large-scale studies, it looked at patients' parents' reports and clinician reports. And the patient's parents' reports, less than 50% pain, as in reduction of pain, and the clinicians reported more than 70% reduction in pain and fear in their clinic. Now that we have seen the efficacy of virtual reality and how there is data showing that it may have comparable pain control similar to opioids for the purposes of vaccination, we can use safety factors to determine and help guide our choice of therapy. When compared to opioids, virtual reality actually has a much better safety profile. There is a lack of notable side effects that are found in opioids, common ones such as nausea and constipation, and really severe ones such as cognitive impairment and respiratory depression. And as we talked about previously, there are ancillary benefits to using virtual reality, such as decreased refusal rate and decreased association of clinic offices with vaccinations, which make them less likely to refuse to come back. For economic factors for your consideration, the actual price of the virtual reality system is not as big of a deal as you would think because there are variable costs. On the more inexpensive end, there are lenses with a smartphone insert, which may cost you about $20. Obviously, the smartphone is not included in that. And there are more expensive systems such as the Oculus system, which may cost you about $200 to $400. Now, in terms of pay reimbursement, it's not currently supported by health insurance, so that's actually more of an issue. And in terms of cost recuperation, you would have to rely on the cost savings from using less opioids and the ancillary benefits that may reduce costs. However, this is difficult to quantify because it's difficult to measure directly. So, what are some insights and what is the anticipated future impact of virtual reality? Well, its increasing acceptance as a healthcare tool allows us to better utilize the technology, along with decreasing barriers such as improvement in hardware with less expensive costs. It allows us to take full advantage of using this kind of technology without taking as much risks, monetarily speaking. The benefits of virtual reality are becoming increasingly clear with more data, and we know that virtual reality has a great safety profile. Some potential barriers to using virtual reality is still the question of reimbursement, since healthcare industry doesn't actually give any kind of reimbursement for using virtual reality right now, so it's going to have to be out of your own pocket. And the perception of this technology, which is mainly used for entertainment, may not be taken as seriously right now. That's it for the presentation. In summary, virtual reality is an interesting new technology which could have benefit in the pediatric population, especially in terms of mitigating pain during vaccinations, which could be extrapolated to other procedures. It has comparable efficacy and a low cost, which allows clinics to experiment with it with very little risk, but it has no reimbursement value currently. With more data coming out, this could potentially be a good alternative to either no pain control or using opioids in the future. Below are some assessment questions to assist in the comprehension of the presented material.